Good afternoon, everyone. Welcome to today's webinar on interprofessional health care teams hosted by Dr. Donna Weiss. I'm going to kick things off today with a brief introduction of our speaker, Donna Weiss. After that, she'll take things over and begin by discussing why her and her co-authors wrote their textbook, The Interprofessional Health Care Team. She'll then move into a discussion of interprofessional teams, key features and benefits of the textbook, and finally, how the text and content can be incorporated into your course. And as I mentioned, we'll conclude the presentation with a Q&A section. Donna Weiss is an author, consultant, trainer, and coach in the areas of interpersonal communication, group dynamics, and leadership. She works with academic programs and health organizations in interprofessional curriculum development and team building. Dr. Weiss earned her Bachelor of Science degree in Occupational Therapy from Columbia University, her Master's of Arts degree in Occupational Therapy from New York University, and her Doctor of Philosophy in Psychoeducational Processes from Temple University. She is emeritus faculty in the Department of Rehabilitation Sciences, College of Public Health at Temple University in Philadelphia, where she also served as Associate Dean for Academic and Student Affairs for about a decade. She's an associate with GroupWorks Global and a project advisor for the Foundation for Advancement of International Medical Education and Research in Philadelphia. She's a licensed occupational therapist, a fellow of the American Occupational Therapy Association, and is a certified coach and consultant in appreciative inquiry and whole system IQ. At this time, I'd like to hand things over to our presenter, Dr. Donna Weiss.
Thank you, Aliana. Hello to all of you, administrators, clinicians, educations, and students. I really appreciate your taking time to join us today, and I'm honored to have this opportunity to share our thoughts on the interprofessional healthcare team. I'm really looking forward to learning about your perspectives too, so please plan on taking the opportunity to share your questions and comments with us by posting according to Aliana's instructions. In preparing for this book, we reviewed the literature and interviewed interprofessional teams. It appeared to us that the most successful and sustainable teams had leaders who routinely modeled inclusive, affirmative language and shared leadership. The members of these teams reported that they felt that differences of opinion were welcomed and their contributions were valued. According to recent research reported in a New York Times article, Why Some Teams Are Smarter Than Others, these aspects of collaborative behavior and social sensitivity also seem to make teams smarter and more creative and successful in solving problems. But this isn't just about soft, touchy-feely issues. According to many reports from the World Health Organization and Institutes of Health, improved communication and collaborative teams are linked to improved health outcomes. In Paul Uhlig's book, The Field Guide to Collaborative Care, he has some very compelling information regarding how an organizational structure that fosters interprofessional collaboration impacts patient outcomes. Now, Dr. Uhlig was a member of a cardiac surgery team that was working to reduce the length of time patients were on a ventilator after cardiac operations. Because the entire team had a routine weekly meeting, the anesthesiologists, surgeons, nurses, pharmacists, and respiratory therapists who needed to work together to reduce ventilator times were able to discuss their progress and make continual refinements of their work routines together. The hospital happened to be part of a regional quality network, and the programs at the other hospitals in the network were also trying to decrease ventilator times. An important difference between the programs was that the weekly reflective team meetings that were on Dr. Uhlig's collaborative program, that was the difference. The other programs didn't have this infrastructure for collaboration. So over approximately 4 years, the team with the weekly team collaboration, Dr. Uhlig's team, was able to decrease the average ventilator time from nearly 6 hours to 45 minutes. The other hospitals made progress too, an average of about a 2-hour drop, but certainly much less than the progress demonstrated in Dr. Uhlig's program. So it's really no surprise that quality health care requires teamwork. And teamwork requires the development of a discrete set of knowledge, skills, and attitudes that facilitate interprofessional collaboration. As a result, this set of knowledge, skills, and attitudes is included in the criteria for accreditation for most health professions curricula. So in order to address that need, we thought, my collaborators and I thought it would be a good idea to write a book that showed the link between classic small group research regarding group development and group dynamics and current work regarding relational leadership and collaborative cultures. We also wanted to provide an opportunity to engage in the practical application of these concepts in everyday life. The book is divided into 3 parts. The subheadings listed under each of the main parts indicate some of the key issues that are covered in each part. Those subheadings are listed on this slide. One of the key features of this text was the provision of practical exercises and stimulating questions that would inspire both novices and experts to think differently about their roles and styles as leaders or members of healthcare teams. And I also think that one of the most important things was that we want people to think about leadership as an internally motivated way of being, an internally motivated way of being, rather than just an externally designated position. So we really wanted to have people begin to think of themselves as capable of exercising leadership behaviors no matter where in the organization they stood. The learning objectives listed at the beginning of each of the chapters reflect the objectives and competencies that are frequently included in accreditation guidelines regarding interprofessional education. Activities provided for each section reflect these objectives. So, for example, the activities in Part 1, Teamwork and Group Development, focus on objectives such as differentiating personal and group goals, analyzing developmental levels of groups, and developing strategies to foster high-performance teams. The activities provided in Part 2, Relationship-Centered Leadership, reflect objectives such as analyzing competencies required for health professions leadership, identifying personal leadership characteristics, examining leadership behavior in real-life situations, and developing strategies for personal leadership development. Part 3 was building and sustaining collaborative interprofessional teams, and the objectives of the activities would be developing social sensitivity, giving and receiving feedback, and leveraging the creativity and energy of diverse teams. Thomas Dewey said, "Minds are like flowers. They function best when open." Minds are like flowers. They function best when open. And it was with this in mind that we made sure that the reflections, case stories, and activities were designed with adult learning in mind, often requiring students to draw on personal experiences and providing opportunities to not only expand one's personal behavioral repertoire, but also to share experiences and broaden the perspectives of the group, thereby expanding the group's alternatives for action and the overall collective intelligence of the group. When used as a base for class activities, these teaching learning opportunities also serve to help groups deal with and leverage diversity, help groups understand how modeling and encouraging positive communication mitigates the negative effect of power and status differentials and increases psychological safety in teams. And finally, we also try to show how technology can affect collaboration and collective intelligence in teams. Now, in terms of benefits to the readers, we've found that once people have a chance to try on new ways of thinking and behaving by actively and positively engaging with a more diverse constituency, they and their teams, and possibly their organizations, are forever changed. Once people realize their capacity and responsibility for leadership and their social sensitivity is heightened, they can only increase the collective intelligence of that team, because that social sensitivity engenders a sincere curiosity about where the other person is coming from. So there's a built-in openness to that group. In my own consulting experience, I found that training opportunities that incorporate similar theoretical and practical applications that we provide in the book have yielded excellent results. For instance, in a large mid-Atlantic health system that was interested in improving patient safety as measured by increases in near-miss and unsafe condition reporting, we started with a pilot group of administrative and clinical staff to engage in a 9-module training that included classroom and practical application exercises to enhance participant comfort and mastery of strength-based affirmative communication and inclusive collaborative solution seeking with regard to risk identification. Near-miss reporting after the training went up 72%. The psychologically safe environment encouraged active engagement in facilitating discovery, preventing errors, and fostering accountability. The success of the pilot group cascaded to the whole system as a whole, and the strength-based collaborative approach was championed by administration of the entire system, facilitating a sustainable culture change that led to enhanced patient safety. So we learned that collaboration not only feels good, but it does good. So for me, a key lesson in that experience was that, like a pebble dropped into a pond, the behavior of one individual or a small group of people can have a profound effect, a ripple effect on the larger groups and organizations in which they are part. So we find that the book as it stands is easy to read for students with links to online resources. So it kind of, again, makes the individual's world with regard to interprofessional collaboration bigger. The theoretical concepts are emphasized and clarified by numerous case stories and references. And the practical exercises help students to recognize their own capacity and responsibility for leadership, to be able to explore their unique professional and personal contribution to the team, and to understand how they might facilitate the optimum functioning of the team. Neil Postman was an educator and a media theorist, and he said that our students are living messages we send into the future. And it's our hope, it was our hope in creating the book, that students, clinicians, and educators would use the tools provided in the text to facilitate their own personal transformations into the messengers of collaboration and shared leadership, who would in turn create creative, powerful, interprofessional healthcare teams who provide exemplary patient care and positive health outcomes. In terms of instructors, we found that the active nature of the reflections and activities encouraged personal engagement with the concepts presented in the book. The strong theoretical base, online links again to additional resources, active learning, teaching learning experiences that reinforce the conceptual materials are also appropriate for face-to-face or online educational experiences. And the multiple choice test bank, as well as case story-based midterm and final exams, were helped the instructor to gauge an understanding at the level of knowledge, attitude, and skill by providing multiple choice, short answer, and case-based questions. So by having a variety of ways to judge understanding, it enriched the teaching and learning experience. We feel like this textbook is very applicable to courses in leadership, professional team development, group dynamics, interprofessional health care, organization and development, management, and supervision. Now, with regard to a course integration, I had the opportunity to consult with a health professions educator who was tasked with developing the interprofessional training of a diverse group of health professionals from a variety of different schools across Bangladesh. He developed 3 day-long modules that covered areas such as a basic concept of interprofessionalism, team building, teamwork, and positive communication. He used the reflective activities and end-of-section activities in the book to encourage sharing of diverse disciplinary perspectives and engagement in interprofessional problem solving. And what he found was it served to broaden the perspective of the participants to see themselves as partners in healthcare and to see other healthcare professionals as resources rather than rivals. So the interactive nature of the activities, being able to use some of the opportunities to engage each other in conversations, really started to develop, even in those short-term meetings, a way of connecting people to each other and seeing them as resources rather than rivals. And the interesting thing was those people in turn went back to their areas of the country, and he received a lot of requests to expand that training. So that was a very good outcome for that. The format of the book, in which each chapter can be viewed as an independent module, complete with reflections, activities, and examination questions, allows instructors to develop a standard semester-long course, a topical seminar series, in-service training opportunities, and this can be adopted in a traditional classroom or synchronous or asynchronous online environments. So in terms of integrating this into the course, some of the things that I've done and people I've consulted to have done is using, for instance, case stories as a point of departure for an in-class or online discussion, say regarding theoretical concepts, but starting the class out using those case stories, so breaking the group up into small groups that examine the case stories rather than starting out with a lecture on concepts, to kind of flip it a little and start it out with discussions about the case stories or presenting the case stories, and then have the discussion lead into the conceptual concepts. The reflections are helpful as homework assignments, again, as points of departure for small group discussion topics, online chat topics. They're also very good as lead-ins for personal leadership journal topics, if that's an activity that you prefer to have your students engage in. And then there's always using those reflection statements as a lead-in for short position papers. The activities that are provided at the end of each section, again, are things that can lend themselves to small group, active learning experiences that can introduce students to theoretical concepts. And each of the 3 parts can be used as standalone course modules for short courses, seminars, or in-service training. In terms of additional resources, I did mention the article from the New York Times, and I spoke about Dr. Uhlig's book. The article on the Mayo Clinic, Making Complex Healthcare Simpler, is an interesting article that demonstrates that a patient-oriented institution kind of makes all the complexity of healthcare a bit simpler by boiling down, the thing that informs the decision-making is the question, how does this best serve the patient? And it's a very interesting article on how all the members of the team are focused on that relationship rather than a disciplinary orientation to decision-making. So it's a great article, but shows how that relationship orientation is not only good for the outcomes of the patient, but also good on a variety of other outcomes that are measured in terms of efficiency and effectiveness of health care. And then the National Center for Interprofessional Practice and Education website is an excellent place to get up-to-the-minute information as well as information on recent literature, conferences. It's a great website to get attached to if you're interested in interprofessional education. And I know for the last slide, Aliana can give you some information about how to order a copy, but also, too, if you want to discuss anything further in the future or have questions in the future that come up, my own email is donna.weiss@temple.edu, and I welcome your comments. At this point, we can open it up to questions, correct, Aliana?
Yes, that's correct. Thank you, Donna, for that presentation. That was phenomenal. At this point, I'd like to invite Karen, our operator, back on the line.
Okay, and your first question is from Connie Bishop.
Hi, Connie.
Hi, I'm part of an IPE cross-university collaborative, and we were looking for textbooks. This does include the recommendations for the four core competencies as part of interprofessional collaborative practice.
I didn't hear the rest of your question.
I'm sorry, I have a bad cold. So
oh, I'm sorry.
That's all right. Let me see if I can get it out. One of the resources that we are using is the position paper that was written by the multitude of the alphabets, you know, IOM, ANA, all those good things.
Yeah, uh-huh.
And I'm assuming that, I didn't hear it, but I'm assuming that the four core competencies are woven throughout this textbook?
Yes, they are.
Okay, that's what I needed to know.
Okay, I hope you feel better.
Thank you.
Are there any other questions on the line, Karen?
Your next question is from Catherine Thompson.
Okay, Catherine.
Well, hi. I'm actually teaching a course on professional leadership development, and I'm curious if you have some pre- and post tests that you do for the instruction that you offer students. Right now, I'm a physical therapy professor, and we're looking at developing an interprofessional course across our school of, I guess it's a College of Health and Human Sciences. So do you have kind of some pre- and post tests that you do that go along with, you said you had a midterm and final exam?
Mm-hmm. You mean pre and post, like attitudinal type?
Kind of leadership knowledge for interprofessionalism. And actually, I am working on a pediatric book for therapists, an interprofessional pediatric therapy book, and it's more specific to a narrower team, I think, and for specific population, just because we always do it interprofessionally, but making that step or that leap. So I would see this book that you have, and it sounds excellent, would be a separate type of book. I would be carrying concepts, I think. I already do write about this and share it, but I think you have an exquisite outline of what you present. So, but I'm very interested in the pre and post as we look at leadership development. I've worked with one of my colleagues, Dr. Christina Wisdom, and we have a leadership development tool, but it's very specific. We have the cultural competency in there. We have emotional intelligence. I mean, it's kind of a little different than what I think you're presenting. And I don't know, I could see us developing an interprofessional course based upon your content. Does that make sense?
Yes.
But you're basically telling me you don't have that yet. It would be
no, we don't. In the book, there's no, when I talked about the midterm and the final.
Right.
Those are more based on the content of the book rather than the the pre and post positions of people that are participating. Like, you know, for instance, when you say pre, you're saying, you know, how much do you know about leadership, you know, that kind of stuff, and then you test
other healthcare members, right. It's kind of like we're going to be having students coming perhaps into this interprofessional course from a bunch of different professions, pre-professional programs, and I would venture to say, unless our curricula are perfectly aligned, we're going to need to kind of feel out where they are in different levels. Does that make sense to you?
Exactly. And for tests like that, I do believe that if you go on that website at the University of Minnesota, that website is absolutely terrific. They have a lot of resources. You just go under the assessments.
Okay.
There are a lot of resources on interprofessional collaboration attitude surveys. It's very extensive, and I bet you any money you'll find what you need there.
You are wonderful. Thank you so much. I really appreciate that.
It's right there on the slide. I'll just repeat it. It's at the National Center for Interprofessional Practice and Education, University of Minnesota. Oh, it's right there.
I see it. Yeah, I'll go to that link. Thank you so much. I appreciate that.
Yeah, I think you'll find what you need there.
Thank you.
You're welcome.
Okay, and your next question is from Staceys Question. Please go ahead.
Hi, Stacy.
Hi. So I have been struggling in a acute care mental health setting as an OT, bringing in more trauma-informed and evidence-based modalities, including sensory modulation. And it's really tough with the culture here to get buy-in and trust. And it seems that once I have built relationships where I know people and we have some degree of a working relationship, then I start to do trainings. But it's really hard to get carryover of the recommendations from my consultations, and I did find this as well in the pediatric settings as well, that coming in as an OT once or twice a week and making recommendations, that the tough part is that the interventions need to be followed through on more of a regular basis. So I was wondering if you have any ideas on how to go about like having this kind of carryover to really promote more lasting change.
So it sounds like you're saying that engaging the group in terms of what needs to be done for the particular treatment that you're suggesting. Is that
right?
I think very often when there are a number of disciplines involved in a particular treatment, either for an individual or a group of individuals, the challenge is to get the strengths of all the different participants at work at the same time. And sometimes I think, like my friend in Bangladesh, I think depending on the culture or the structure where you're working, sometimes there's more, rather than people seeing each other as partners in a particular event, they see each other as rivals.
Yeah.
And I think in my own experience, a lot of times in a situation like that, it's almost like you have to get people to the example that I gave about the Mayo Clinic, I think is a really good article, a good chapter to read, because they talk about how at some point people have to not give up their professional orientation, but to really see that one of the competencies that we as healthcare professionals have to develop is that competency of seeing ourselves as a member of an interprofessional team. Mm-hmm. And there are a lot of things that are associated with that, not the least of which is realizing that our treatment is really incomplete unless we take into account the input from the other members of the team. So the question really becomes is how do you get all the members of the team to see themselves as part of a cohesive whole? How do you see them as, and how do you view your partners on this team as people who will leverage your expertise? And that just occurs like, and Dr. Uhlig's book actually is a good book to see how he structured those teams so they really did become a whole bunch of interlocking strengths. It's not a point of homogenizing the health professions, but of learning how to leverage the unique professional orientation of each member on the team. So it's hard work. The answer to your question is it's hard work, and it requires an institutionalized habit of collaboration, of getting together. So that's a long-winded way of saying it's hard work.
No, I think that some of the words you've used really I can latch on to and really glean hope in terms of, you know, it sounds like I have to think of everyone as like, how can I get them to feel more a part of the team? And maybe that's the piece I've been missing. So
Dr. Uhlig's book, The Field Guide to Collaborative Care, is a really very good book with regard to thinking about how to impact that type of change on an institution. It's a good book.
All right. Okay. Now I have a couple to buy. Thank you so
that's
much.
Right.
I need it. I need the help. But that's
I think we do have just a few more questions to try and get to. Donna, let me give you one that came in through the chat. We have someone wondering, have you implemented IPE for online programs, and do you have any advice for doing so in either undergraduate or graduate?
Yes, actually I did a course that was focused more on leadership, but I think the key issue with online IPE courses, as I do believe in other types of courses, but it's always a good idea to see the students who are participating in it as something that's really going to make that program rich. So I make it a point of really coming from the standpoint of where those people from the diverse professions, where they're coming from. And we allow them to share, just like I said to Stacy, to share what's unique about them and broaden the perspective of all the members of the group. So the experiences, the discussions we have are all centered around people kind of co-constructing that experience, if you know what I mean. The people come into the group with experience, with orientation, and they co-construct the experience so that after it's done, each of the members of the group are transformed by that experience because they've been enriched by the members of their team. And they have an opportunity to, by the way the activity is structured, they have an opportunity to be able to see how the other members of the team have enriched their professional ability.
Great, thank you. We have another question that came through the chat. Is there a chapter on field experience, and do you recommend field experience in IPE?
We don't specifically have a chapter on field experience, or although depending on what the issue is that you want to get across, I think a lot of the reflections and activities are very well suited to applying to field work experiences. I was a field work coordinator for many years, and I think my experience in there kind of informed the way some of those reflections and activities are designed. And I think they would be very appropriate to use in field experiences, especially in interprofessional field experiences, especially in situations where there are a number of students from various professional programs. A lot of those activities are things that really lend themselves very well to fieldwork learning experiences.
Great, thank you. We have another question coming from someone who works in a very busy EMS unit, and they're wondering if this has been tested for EMS, or if this is more relevant to management.
You're saying emergency medical?
Yes.
No, these haven't been tested per se, but there are a number of citations in the book, throughout the book, that do relate to some research on emergency medical. Actually, there's an article, Chris Burchell, a colleague of mine years ago, did his dissertation actually on mortality rates and the perception of cohesive teams, and found that emergency room groups that perceive themselves as being more cohesive in terms of group dynamics issues did in fact have lower mortality rates. And actually his work has been cited quite a bit in some of those reports regarding collaboration and good patient outcomes. So I would refer you to Chris's work. His name is Chris Burchell, Burchill. And so his research was done quite a while ago, but I think there are things more recently that would address those issues in terms of paying attention to collaborative behaviors and emergency medical teams.
Thank you, Donna. It looks like we have just one more question that came in through the chat. We have someone wondering how you would evaluate outcomes of an interprofessional team.
I'm glad you mentioned that, and I go back to, we don't have testing or evaluation in the book, but there are assessments that are being developed, and you can check on the development of those on the University of Minnesota site. I know they're working on them, but there are quite a few assessments that are out there, and I don't know what their reliability or things like that, but I know there are quite a few out there that you can look toward. But I would, again, urge to go on that University of Minnesota website and look under assessments, and you probably will find the thing you're looking for.
Thank you, Donna. Karen, do we have any other questions on the line?
Yes, ma'am. You do have another question from Cheryl Scott.
Hi, my name is Cheryl Scott, and I'm from Memphis. I am currently in the midst of my dissertation, and I'm using your book as my conceptual framework. And I wanted to know, one of the big things that I've seen in nursing education and PA education is that there is a lack of a group formation. And I was wondering, do you have any specific exercises that help a group to develop?
Well, actually, a lot of the exercises that we have in the book do help with that kind of stuff, but there are myriad exercises. You know, you can find things online and things like that. But I think the important issues are to make people aware that there are developmental levels in groups. You know, I think that's one of the things that sometimes we take for granted, that people would know these things about groups, and a lot of times if they get the information about group development and that groups actually develop in a way that's not unlike the way we as humans develop, then they'll be more realistic about what they expect groups to be doing at certain points in time.
So what we've done is I've developed a 4-module set for a group of nurses, PAs, ophthalmologists, and pharmacy students. And we're working through the talking walls initially so that the students understand, first of all, what each other does and the misconceptions of each profession. And, you know, there's a lot of speculations of when to do that in the curriculum, but we're starting out with it. Even though that they're neophytes in their professions, we feel that they have to have an understanding of others and that working relationship in an ongoing fashion, so that when they are in the hospital situation, that they can use that information to their benefit, and that they are a working member of a team.
I think one of the things that I've found, you know, there are a lot of different ways, and if you, during your work on it, you've certainly seen them, there are a lot of different activities and trainings that you can foster group development with. I think, in my experience, one of the most profound experiences I've ever had is that you kind of develop people's curiosity about other professions. In the health professions, we put a big premium on knowing, and that's important because you have to know a lot of clinical information and you have to be able to make clinical decision-making and that kind of stuff. I think one of the things that has to be developed, though, is people's ability to be curious and ask questions of other people. Right. And I think when you have activities like that, where people aren't really telling but asking, and really start to develop that ability to ask questions, they not only become better collaborators, they become better clinicians, because then they're able to ask their clients or their patients, really consider that they are part of the puzzle. They have a lot of information that's important. So I think those have often been the most profound experiences. That experience I had at that large health system, one of the main takeaways of that is people went out and went to their peers and their subordinates, and rather than telling each other, they developed an ability to ask questions of one another, and they just became more collaborative. They just, again, saw each other as real resources rather than rivals. Right. So I think those are the types of activities that make the most transformative results.
Okay. Thank you.
You're welcome.
Thank you, Donna. I think we have time for just one more question that came in through the chat. We have somebody wondering if this book would be something that would enhance an interprofessional simulation, and if you've used any of these concepts to develop any kind of interprofessional simulation.
Like in a simulation lab? Is that what
I believe so.
Yes. I think these could be used for the people that were working in the simulation lab. My advice would be this would be the type of thing that would be preparatory, and then also using some of the activities afterwards to reflect on the interaction. I have not used it with people in a simulation lab, but I can see where they would be easily adaptable to that environment.
Thank you very much, Donna. I think that's going to conclude our session today. I do just want to remind everyone that this book will be available next month. If you're interested in requesting a review copy for course adoption consideration, you can follow this first URL on the screen here, go.jblearning.com/Weiss2E. And then also, if you're interested in any sort of custom options, whether it be using pieces of this textbook in your course, you can reach out to Dan Sowers, and his email is right there on the screen.
I was just going to say you're welcome to drop a line to me at donna.weiss@temple.edu.
Okay, great. Thank you, Donna, and thank you, everyone, for joining us today.
Thank you.